So without further ado, I'll introduce you our second speaker, Ms. Deepa Bose. She's a consultant in orthopedic trauma and limb reconstruction at the Queen Elizabeth Hospital in Birmingham. She's also the vice chair of the Specialist Advisory Committee for Trauma and Orthopedics, the lead for the CSER approval process, and the chairwoman of the World Orthopedic Concern UK. So yeah, please, the stage is yours.
Okay, fantastic. Thank you. So, I mean, this rather grandiose title, please don't be misled by it. But I was put on the spot to think of a title, and this is really all that I could come up with. So please don't be misled by the title. But I just wanted to share with you a couple of things that I wanted to know when I was a medical student or a young trainee. So we'll start with, what is a typical orthopedic surgeon? And we know that even now, there is a certain perception about what an orthopedic surgeon is or what an orthopedic surgeon looks like. But actually, we know that this is no longer true. And if you look at this slide, every single person in this slide is an orthopedic surgeon. They're either consultants or trainees, and you can see that they come from so many differing backgrounds, different genders, different colors and creeds. And so actually there is no typical orthopedic surgeon. So that is a myth that you must put out of your mind straight away. Echoing what Deborah has just said, there is also a perception that orthopedic surgeons have to be very strong, but in actual fact, technique wins every time. And if you find yourself using a lot of physical strength, then generally speaking, that means that something is wrong somewhere, because technique always works. Of course, if you want to be a surgeon, then I do feel that you need a minimum level of stamina, because it is obviously a fairly physical job, but you certainly don't need to be strong. I'm not strong, but I do have a technique that works. There's also a perception that orthopedic surgeons are not particularly clever. We're said to be as strong as an ox and half as clever. But if you look on the left-hand side, you will see this little very amusing study that was done a couple of years ago saying that orthopedic surgeons are as strong as an ox and twice as clever. And it's in the Christmas edition of one of the BMJs. So I would urge you to find it and read it. It's very funny. But in order to do orthopedics properly, you do actually have to know quite a lot of different disciplines. So there's anatomy, there's biomechanics, engineering, molecular biology, microbiology. It isn't all just, hammering and putting screws in. So there is actually lots to exercise your intellect. So this is always quite a popular question in conferences. Can you have a family life and do surgery? And actually, yes, most of the domestic burden still falls to women, but actually there are so many orthopedic surgeons now who very successfully combine having a family life with being an orthopedic surgeon. And currently on the Birmingham rotation, we have 2 male trainees who have taken long-term paternal leave. So not just 2 weeks, but they've actually taken 6 months out of their training for childcare purposes. And we have one male trainee who is less than full-time. So you may know that we no longer use the word part-time because that is said to be pejorative and it has certain derogatory connotations. So we don't use that phrase any longer, but we do use less than full-time. So we have one male trainee who is less than full-time for childcare reasons. So actually, the landscape is changing. It may be a glacial pace of change, but the landscape is changing, and it is more equitable. And actually, as I've said, there are many, many orthopedic surgeons who successfully combine having a family life with their job. So I've mentioned less than full-time. So currently, anyone can work less than full-time, but there are certain categories of less than full-time training. So if you have dependents, or if you are, for example, an Olympic athlete and your personal and professional development requires you to work for less than full-time, then you can. But from August, there is another category of less than full-time training, and that essentially says that you don't have to justify your reasons. So anyone can work less than full-time if they want to. And there is obviously a growing realization that less than full-time doesn't mean less than fully committed to your job or to your profession. That there was a certain belief or myth that being less than full-time means that you're not particularly interested, or that your profession came second to other things in your life. But we now know that that isn't true, of course, and we must all perpetuate this understanding that less than full-time doesn't mean less than fully committed. Of course, if you want to go less than full-time, you should understand that acquisition of surgical skills will take longer. As any sports person will tell you, the more you practice your craft, the more you hone your skills, the better you will get at acquiring and practicing those skills. So if you are doing less than full-time, then there has to be that understanding that you will take a little bit longer to get there. But there is the ability now for you to work less than full-time, and it certainly doesn't detract from your final position as a consultant. Is it a tough life? Well, yes, it is, of course. If you were to work in the city, or if you were a high-flying lawyer, then you would have a hard life, because you put everything into the job that you do. And I think, similar to what Deborah was saying earlier, I don't know if I've achieved a good work-life balance, but what I have achieved works for me. And it's a good work-life balance for me because I love what I do. And so, yes, the job is hard, but it's hard with or without family commitments. And it demands and requires your absolute attention when you're doing it, and all your effort when you're doing it. But in fact, would you say that you would want to do a job where it doesn't require your full attention or your full effort? I don't think any of us would want such a job. And so, yes, you do have to really love it in order to do it properly. And it is a tough life. And I think that it would be wrong of us to try and put a so-called positive spin on that, because we know that it's difficult, but it would be equally difficult if you were working in the city, or if you were working as a lawyer. It would be just as hard. However, is it a rewarding life? 100%, or as the Americans would say, 110%. Orthopedics is fun, and you get to use a hammer. I mean, what could be better? What could possibly be better than waking up in the morning and going to work and being able to use a hammer? You require problem-solving skills, so if you enjoy solving problems, then definitely something that you could consider. I like the fact that everything seems to make sense in orthopedics. It's quite logical, and you get instant gratification, because if you are fixing a fracture or if you are replacing a joint, your patients tend to do well. So we don't tend to get very ill patients, and whatever you do, the patients tend to get well. It's also a team sport. So if you enjoy team sports, then definitely something that you can consider. Like all surgical specialties, it is a team sport. So yes, it's a hard life, but it is extremely rewarding. And I don't know of any orthopedic surgeon who would tell you otherwise. There's been a lot of changes in recent years. So you will know by now, or you may know, that by 2022, there will be female presidents of the orthopedic societies in the UK and in Australia and in Canada. So there are now lots of positive role models, apart from your typical, sort of the stereotypical version of an orthopedic surgeon. There are lots of other role models. We are now reaching out to medical students to show them that actually, if you haven't thought of this as a career, maybe you should. There are lots of opportunities for flexible working, flexible training, and even when you become a consultant, you can be less than full-time. So there are now many different opportunities that accommodate lots of different lifestyles. We're now starting to respectfully challenge old attitudes and behaviors. And there is now quite a few, in addition to the informal mentoring and peer support that you get, there are lots of formal mentoring and peer support programs in place, and there is equitable parental leave. So the landscape is definitely changing and allowing more of the sort of atypical orthopedic surgeons to come through. So yes, in summary, it is a difficult path, but why would you want to do it if it wasn't difficult? And it is definitely 100%. It is the best job in the world. Thank you.
Thank you, Ms. Bose. Yeah, I can totally relate to that point. I love using the hammer legally at work as a doctor. It's quite satisfying. Great, thank you for a very enlightening talk. Really enjoyed that.